Good morning, everyone. My name is Sal Valadez. I am the chair for ECORN, the chair of the board of directors. On our board of directors' behalf, we would like to welcome you to this event on stigma awareness. And please join me in welcoming one of our board of directors members, as a matter of fact, and the Addiction Policy Forum is a partner with ECORN-MO, along with the Opioid Response Network Midwest Region and our other partner organizations. So I will like to introduce you to my friend Kayla Zagwilzak from the Addiction Policy Forum. She is the Director of Patient and Family Services. Kayla, I'm going to pass it over to you.
Thank you, Sal, so much for inviting me to share about such an important resource that we've done in collaboration with ECORN-MO and lots of different people that are on the board, and a number of different other organizations. And I also have to give a shout out to the Syncora Impact Foundation because they have helped provide us grants that have made the work that I'm going to talk about possible. So I could not continue without saying thanks to them for helping support this important initiative. So like Sal said, I'm the Director of Patient and Family Services at the Addiction Policy Forum. And so thank you all for joining me this morning. I'm sure it's hot and it's a Friday like we talked about. So in case you don't know about the Addiction Policy Forum, we're a nationwide nonprofit and we're dedicated to eliminating addiction as a major health problem. Some of our strategic priorities include helping patients and families in crisis, ending the stigma around addiction, expanding prevention and early intervention services and approaches, as well as increasing the uptake of evidence-based practices and advancing research. We know that when something is found to be evidence-based, there generally is a 17-year gap from when it is implemented. And so what we try to do is really translate the findings into digestible formats, so people understand it and get the information and they don't necessarily have to read a 100-page journal article to learn about it. And that plays into what we're going to be talking about today, which I will explain in a little bit. So today I'm really going to dive into a little bit about stigma and how it impacts individuals, especially individuals who are of the limited English proficiency community, as well as immigrants. And then we're also going to talk about different effective stigma interventions. Um, and then, so first about stigma. So many of us, we talk about stigma, but knowing what it is. So stigma is the perception that a certain attribute makes a person unacceptable, different from others, and leading to prejudice and discrimination against them. And so this, many times we've talked about this, whether it's in the HIV space, mental health space, but this is really, I think, more of like a hot topic within the substance use disorder space recently, because we really see how it impacts individuals from reaching out for help, going to healthcare settings, and so many other pieces. So this is one really great quote about stigma from Dr. Irving Goffman, who's a Canadian-born sociologist and social psychologist and writer. So they said that stigma is the situation of an individual who is disqualified from full social acceptance. The stigmatized individual is reduced in our minds from a whole and a usual person to a tainted and discounted one. So we know through research that addiction is the most stigmatized condition worldwide. And so this is why it's so important that we talk about it in evidence-based ways that we can combat stigma and decrease stigma. So just a little background information about stigma. Stigma shows up in many different ways. And so through the literature, we see that stigma can show up in labeling, why we call individuals certain names, discrimination, how we're treating someone, and our behaviors towards them, stereotypes, the way we are thinking about someone, maybe status loss. We're looking at them as not as equal because of their substance use disorder, as well as separation. So keeping someone at a distance. Maybe we're looking at that as we don't want recovery housing within our community, or I don't want someone with a substance use disorder to marry into my family. So when we look at stigma, it's really important to look at, there's different types of stigma. So we have structural stigma, which is societal levels, conditions, cultural norms, and institutional policies that constrain the opportunity, resources, and the well-being of individuals that are being stigmatized. then we also need to look at the individual perceiver. So we want to also differentiate individual perceiver from the target. So perceivers are people who don't necessarily live with a stigmatized characteristic and may perpetuate the stigma. So this is something like maybe the treatment that doctors, nurses, employers, coworker, friends, and family members provide to individuals with substance use disorder. While individual targets are people who live with the stigmatized characteristic themselves. So this is someone who is living with a substance use disorder, or maybe this is a person who has criminal justice involvement. And so we also know that within that individual person, there is internalized stigma, so stigma that one feels towards themselves, which is endorsed by negative beliefs, feelings, and so these are the thoughts that individuals have about themselves. There's also enacted and experienced stigma, which includes experiences of discrimination in the past or present. Maybe someone goes into the doctor's office and receives poor care within a medical setting because they have a substance use disorder. And then there's also anticipated stigma, which refers to the expectations of discrimination in the future, like expecting to receive poor care in the medical setting. And I should have said this earlier, but stigma and what we do is extremely important to me because I am a licensed clinical social worker, a certified alcohol and drug counselor, but I'm also a person in long-term recovery. And so I have firsthand experienced stigma, and know how it can be so damaging, even as someone in recovery, while going in and having my son. The treatment that I received, disclosing that I was in recovery, I could see the stigma in the way that the healthcare staff were treating me. And so this is something that I think is extremely important, and I'm so grateful that we are talking about it and say I'll put together this webinar. So when we think about stigma, it's really important to think about how it manifests, because when we understand stigma more, then we can combat it, decrease it, and educate folks around it. So when we look at stigma, it shows up in stereotypes, prejudice, and discrimination. And this next slide I like because it really breaks it down. And so if you have not heard of Dr. Valerie Earnshaw, who's out of the University of Delaware, highly recommend you check her out. She is an amazing stigma researcher that we have been able to do lots of work with. And so she wrote this article about stigma, and she likes to think of it as these three major domains of stigma. And so the first one is stereotypes. So these are inaccurate beliefs, thinking that we have within our mind about a particular group of people. Then we have prejudice. These are negative feelings, and we think about that like in our heart, our emotions towards this specific group of person or people. And then the stereotypes prejudice lead to discrimination. So this is resulting from the stereotypes and the prejudice. This is negative actions or unjust treatment of particular groups. This is a great chart that gives examples of different stereotypes, prejudice, and discrimination. For example, when we think about stereotypes, maybe folks think that people who have a substance use disorder, whether they're active in their substance use or they're in recovery, that they're dangerous and unpredictable. Maybe that they're immoral, that they're to blame for their own condition, and maybe that they're unable to make decisions for themselves. So those are the thoughts that we have in our mind. While the prejudice, the things we feel in our heart, maybe we feel fear, lack of trust, anger, disgust. And then discrimination, how we're treating people. Maybe we keep people at a distance. Maybe we do not want them to marry into our family. Maybe we do not want that recovery house within our community because we don't want to bring those people within our community, even though we are everywhere. Maybe there's a decreased intention to help. Maybe folks are denied jobs, housing, child custody because of their history of a substance use disorder. Also, many times people are denied access to healthcare. And then also lack of public support for services, just like that one that I was talking about, where we don't want that recovery house within our community. We don't want that treatment center. I know that's something within the community that I live in. One of the towns, they had all these voting about having recovery housings. And little did they realize, like, this is something that the community needs within it, and folks are already here, and so you could just help support them. And so, why do we need to talk about stigma? We know that people that experience stigma, especially within the substance use disorder space, are more likely to continue engaging in substance use. We also know that there's a greater delay in treatment and access to treatment, as well as higher rates of dropout, especially if they're experiencing the stigma while they're receiving treatment or care. Excuse me. We also know folks that experience stigma within the substance use disorder realm, as well as the criminal justice involvement. They have greater psychological distress, they have decreased self-esteem, greater social isolation. And so we know that stigma really impacts people and really the trajectory of where they go or the decisions that they make or the help that they reach out to. And it's really important to talk about intersectionality. So intersectionality emphasizes the different aspects of one identity. Maybe this is race, gender, social class, sexuality. And so these different pieces of our identity really create a unique experience for each individual person. And this can lead to maybe privileges or maybe to oppression. And this is something I took this quote from Kimberly Crenshaw. And so it's really important that when we are looking at someone, whether we're trying to provide education, maybe we're trying to provide resources, maybe we're trying to provide support, it's really important for us to think about these different identities of each person because they're really going to dictate how they engage with things, the access that they have, their viewpoints, their perceptions. And so it's really important because this information can give us, looking at these different parts can give us a lot of information to really help support people or to understand behaviors. So when we think about intersectionality within the addiction space, it's really important to think about, okay, how does this impact folks? The first thing is looking at the different pieces of someone's identity can really impact their pathway to developing a substance use disorder or their initiation of substance use. For example, maybe there's a lot of community violence, or maybe there's discrimination, or maybe there's family instability. These things can really impact someone into developing a substance use disorder. Also, there are some communities that have economic disadvantages. And so, really knowing that sometimes because of the disadvantages that they're experiencing within their environment, this can lead to the normalization or using substances as a coping strategy. We also know that certain groups of folks, maybe different races, people with disabilities, maybe the LGBTQ plus community, may experience more stigma as well. Um, and really experience a lot of rejection, violence, or mental health issues as well. And so looking at these different pieces of someone is so important so that we can help reach that individual, taking an account and really help them as a whole person rather than just one part. We also know that when we look at different pieces of people, there are barriers to treatment. Sometimes treatment centers do not have culturally appropriate or responsive treatment approaches. And so folks can feel very unwelcome. They can feel like they can't connect or relate, or it doesn't, I don't want to say it doesn't apply to them, but it doesn't really apply to them. There's also structural racism and discrimination. And so folks can many times receive biases within the healthcare system. Maybe they're getting underdiagnosed. Maybe there's overcriminalization or lack of access to quality care. We also know that different, especially maybe like, let's look at mothers. Mothers many times can experience different gender challenges within the substance use disorder space because they may be worried about losing custody of their children. Or a lot of times it's really challenging for whether a pregnant or a mother with children to find treatment because what do I do with my children if I go to treatment? There's not many treatment centers. I know in Chicago we used to have a treatment center that would accept women with their children, and unfortunately, due to funding, it had to shut down. And so there's a lack of resources to support different groups of individuals. And then we also know that the stigma that individuals experience based on their different characteristic also impact the outcomes in recovery. Many times, maybe housing, employment, maybe legal challenges get in the way that can really impact someone within the recovery. We also know that maybe recovery resources, maybe there's not peer support groups that are inclusive of some of these identities and pieces of this individual. And we also know that there can be trauma re-exposure, discrimination, and these things can really become challenging in someone's long-term approach to treatment. So these are a couple examples of how we can look at intersectionality within the addiction space. So for example, when we think about the idea of the war on drugs, the war on drugs interacts with racism. And so different races within our nation were impacted differently because of the war on drugs. We know that there was in the Anti-Drug Abuse Act of 1986, which introduced sentencing disparities between crack and cocaine, or crack cocaine and powder cocaine, led to racial sentencing disparities. So we know that people who are Black and African American were being sentenced much harder than folks who were white or Caucasian. And so that's how we look at, okay, someone has a substance use disorder, someone's race. These are impacting people differently. Another thing that we can look at is immigration status and language barriers. Someone who may be undocumented may avoid seeking treatment for fear of deportation, and then they also may lack access to culturally and linguistically appropriate care. And so, someone has a substance use disorder, that's one part. Their immigration status is another part to them. Their language barrier is another part to them, and they all create unique challenges for this individual. And then another example of this is socioeconomic status and rural location. So this is another example of different characteristics. So you have socioeconomic status, maybe they're low income, maybe they live in a rural location, and then maybe they have a substance use disorder. And so many times people within um, like this kind of having these different kind of parts, they have limited transportation, maybe they have limited insurance coverage, maybe there's limited provider availability, especially in rural communities. And then these different pieces really come into play because they're not able to access the support, they're not able to access the resources. And I'm going to get into this a little bit deeper. So when we look at stigma within rural communities, um, it's a different because within rural communities, not every rural community, but many rural communities are very close-knit social networks. So they're very tight connected communities and there's interconnected relationships. So maybe you work with someone and then you also go to church with them and then maybe your children go to school. Or maybe you are a counselor and you go to school with someone or you go to church with someone and then you see them as a patient. And so there's dual relationship and interconnectedness which create can be very challenging. There's also different cultural norms and values. Sometimes there's very strong emphasis on self-reliance and independence. And so admitting that you have a substance use disorder and reaching out for help can be looked down upon. Also, there are fewer public education campaigns. And so when we don't have education and we don't have knowledge of evidence-based research-backed information, it can lead to a lot of myths and misinformation. For example, someone might believe that a substance use disorder is a choice or a character flaw, which then perpetuates that stigma because we don't have all the pieces of the information. And so these consequences lead to avoiding treatment, maybe delayed treatment, and a lot of other things, isolation, not feeling connected. And so it's really important to look at these different pieces, like if someone lives in a rural community. We also take a little deeper look into stigma within limited English proficiency and immigrant communities. And so there might be, cultural and familial expectations. Maybe a family believes, oh, if someone has a substance use disorder within my community, this is going to ruin our, someone has a substance use disorder within my family, this is going to ruin our family reputation. This is going to be coming going against our honor as a family. Maybe they see, oh, this is a moral failing. Why are you weak? Why are you bad because of this? Um, Also, families might believe they want to avoid shame or being kind of ostracized from different groups. And so this is an added stressor and kind of not like consequence, kind of like a challenge that folks within the immigrant and LEP community experience. Another thing is maybe someone is worried about their legal status. And so therefore, this really provides a different challenge because I can't seek help because I'm afraid of what's going to happen for me. Um, maybe I'm afraid of the child welfare system getting involved. Also, like I had mentioned before, many times information is not translated or transcreated into culturally appropriate um, formats for individuals. And so it creates a huge challenge because, we have so many resources created in English, but we're not thinking about these different subpopulations that need this information just as much as everyone else. And then sometimes maybe there's religious or spiritual influences, which make it more challenging for folks to share about their substance use or the challenges they're experiencing or reaching out. Many times folks might think that they're going to be judged or that they need to focus on their spirituality and maybe that is going to solve something, but maybe there's all these other pieces that are coming into play that they need to address. And then we also know there's systemic and structural stigma. So what do we do? There's stigma. We know there's stigma. What we do is we look, and this is what we do at the Addiction Policy Forum. We look what has worked in other spaces, and let's try to implement it in the space of substance use disorder. And so this is a great article. I can wrap it up in a follow-up email. It's a very long. I don't know if you call it an article or what. It's very long, but it has great information about evidence-based approaches to decrease stigma. And so one that I'm going to really focus on is education. As well as it's kind of like a media campaign and different pieces of that. And so these can be utilized to decrease stigma. And so what we're here today to talk about, we talked about stigma. Now we're going to talk about what kind of resources are available to you. We have been able to create these resources in partnership with the Sincora Impact Foundation, ECORN-MO, and as well as ORN and so many different communities. And so the opioid prevention campaign, this was first developed in 2020. And this really provides a public health media campaign to help prevent adolescent substance use. And so this provides resources, videos that folks can utilize to provide information to their community. And the reason why I'm going to dive into this is because this is the stuff that we have transcreated and translated into different languages. So the first two things I'm going to talk about is we have 12 things parents can do to prevent addiction workbook. It really dives into the 12 things parents can do, which many times we don't know what we can do. And then there's also a video. The reason why we created different formats because different folks respond differently to different mediums or forms of communication. And so that is something we do at Addiction Policy Forum that I really love is that we take information and we're like, how best are we going to reach the population that we want to serve? And then we talk to that population. How is the best way for us to relay this information to you? And then we ask, is this a great way or is this not a great way? Is this a good resource? How can we do this better? So we really collaborate. And that's something that we've really grateful that we've been able to do with these different languages. We've been able to ask people for their insight to enhance it, to make it better. And so these are really great resources to really support parents. We also have one pagers. It's really important for us to correct the misinformation and the myths about how addiction impacts the brain. And so this provides information in a one pager to really give the person a deeper understanding about the neurochemistry, how it affects the brain, and how it is a brain disease and a brain disorder. And so we have an addiction in the brain one pager, as well as how addiction hijacks the brain. And as you can see, they're different formats. We got kind of like an infographic and then a one pager. We also have specific materials on teens and opiates. We have a video and then we have a one pager because we really wanted to help provide information specifically about youth, but this is going to help adults, caregivers, teachers, anyone that works with youth, as well as youth. And so this information also really can provide information and background into individuals as they're an adult, maybe struggling with substance use as well. Then we also have a one pager that is how to practice refusal skills. This is many times something that people don't think about. We need to help people and coach them. We know that folks are going to be, especially youth, offered substances. We need to help them and coach them. How can you respond? And we know that not every person is going to want to respond in the same way. And so this is something that is a very valuable tool to help someone feel more confident in their response. Then we also have a video that's 7 things teachers can do to prevent addiction, because we know teachers are, a very special, they have a very special place. Teachers sometimes can be that trusted messenger to that child. They can be that support. They can be a role model. They can, set boundaries. They can really help further some of this information to the children that they work with. Then within the opioid prevention campaign and within some of the languages, we also have a partner toolkit, which is these are fantastic because say your organization wants to help get some of this information out there. We already came up with sample tweets or sample messages. There's graphics. We try to make it as easy as possible so that folks can just take this and roll with it and put it out to their community, organization, and their network. This is a little look into the different graphics. These are some of the graphics that we've created that you can then utilize when you're disseminating this within your community. And we know some folks, the internet is the way to get to folks. And so providing this information, and this is something that, we can correct myths and misinformation by providing accurate information. As you may see through a lot of our stuff, we don't necessarily like, hey, stigma, but how you can address stigma is by correcting those myths and misinformation. Then last year, we created Facts About Fentanyl, which is a video explainer that really provides important information on counterfeit pills, the risk of fentanyl exposures, and steps communities and families can take to prevent overdose and substance use disorders within their community. This has been extremely important with, as we know, the rise of fentanyl within our communities. And so this is a great video. It's just like a 3 or so minute video to really help educate folks. Then the other video that we came up with and released last year is what is addiction? And so this one we really is geared towards decreasing some of that stigma by correcting some of that misinformation. And so this video explainer walks through the science of addiction for family members, caregivers, community members. And so this helps understanding addiction through a health lens to help the treatment of individuals with a substance use disorder, to really elicit more empathy and promotes more effective prevention and treatment strategies. This video really talks about how addiction has biological components, such as maybe the brain, as well as psychological and social components. And so these 3 domains, which we look at as the biopsychosocial, recognize that there's multiple pathways to developing a substance use disorder, such as maybe a genetic predisposition, maybe psychiatric and psychological factors, maybe unhealthy coping skills. And so it's so important, just like we're talking about, we need to look at all these different pieces of an individual. We need to look at all these different factors when we're treating someone so that we can really help the unique needs of each patient. So after we created this, we then released the La Campaña de Prevención de Opiades. I probably said that not the best way, but we released all of this information. I see people laughing, thank you. All this information in Spanish, which is so exciting because we know there's such a high population of individuals who speak Spanish. And one thing that's really important to mention is that maybe someone does speak English, but they prefer to read and hear things within Spanish. Some people have preferences of languages that they access materials in. So this can really help people maybe that don't speak English, maybe it's limited English, but maybe they just prefer to speak Spanish and hear things in Spanish. And so this is all available, and I'll leave some links and I'll also follow up with different kind of resources so you can see this. But this was a very exciting thing to be able to release to the community because it is a resource that is not very available to folks. And then the following year, we were able to release this information in 12 languages altogether. And so I'm going to walk through quickly the different languages that we have released. And this is very exciting. We have, the facts about fentanyl. We have the what is addiction. We have some of the videos. We have some of the workbook and the infographics for these languages. And so it is so exciting that we are able to release these languages because this is something that is not out there for folks. This project was supported by the Syncora Impact Foundation, the ECORN-MO, which you all are here for today, the Opioid Response Network, Mid-American Addiction Technology Transfer Center. And so lots of people came together to make this possible. And so the first language that we have is Arabic. And so you can see little examples of the different materials that we have. And what's great is like we listen to people. Some of our partners are like, hey, when you post things, make sure you put the English version underneath it as well, because maybe I'm helping a family member who speaks Arabic, but I don't speak Arabic. And so I need to know what resource I can provide to them, and so we love to hear things and get feedback from folks so that we can make sure that it's best going to fit all the people that are going to access these resources. The next one we have is Bosnian, which I think is like one of a lot of people have been accessing Bosnian. We have Burmese, and I just think it is, I guess I'm just excited about this, but I think it's so cool that we're able to offer these in different languages. And just seeing the different languages, it just shows, I think it's just beautiful because it just represents different groups of folks. Then we also have Chinese, we have Dari, we have French, we have Pashto, we have Somali, we have Swahili, we have Tagalog, and then Ukrainian. And so just to talk a little bit about the reach and engagement of these resources, and one thing, I think Sal and folks at ECORN-MO and the people that utilize these resources, it is fantastic because you can take an active approach or you can take a passive approach. Maybe you want to print some of these one-pagers or materials and just leave them at maybe your community religious centers, or maybe the health department, or maybe somewhere else. You can leave this information and passively pass it out so folks don't have to necessarily reach out to someone. They can see it and be like, oh, this could be interesting and or helpful, and put it in their pocket. And or you can actively within the St. Louis community, there's a lot of initiatives and a lot of things that Sal and everybody does to have events talk about these things, and so they're actively passing it out. And so it's really important to think about that there's multiple ways that we can provide this information to folks. So when we look at the reach that we have with all these resources, it's really awesome that it has reached all 50 states. We have seen people access it within 20 different countries. Some of the top countries are the United States, Canada, UK, Philippines, and India. So this is really great to see that this has a worldwide impact, as well as a nationwide impact. Then this is from the past few years, as well as the first quarter of this year. And this is interesting because it gives like a little insight into the most accessed languages within our kind of like our treasure chest of languages. So as you can see, Burmese is up there, and on Somali as well. And so it's really exciting to see where people are accessing, what languages they're accessing, to have more information. And then quickly, I'm going to talk about some upcoming resources. This last year, we got a grant to create prevention videos specifically for youth. And so that is our Protect Your Brain. And so why are we so focused on youth? So in case you did not know, over 90% of adults with a substance use disorder began using alcohol or drugs during the adolescent. We did this study within within Addiction Policy Forum called Patient Journey Map, and of 60 folks that we interviewed, everyone started using substances before 21. The youngest someone started using substances was 5. The latest someone started using substances was 19. And on average, folks were about 13, 14 when they started using substances. So we know that this onset is in adolescence. And we know that the brain doesn't fully develop until about 25, 26, depending on the gender. And so we know with earlier initiation of substance use, it is associated with higher lifetime risk of adverse effects, mental health disorders, academic difficulties, physical health issues, as well as cognitive impairments. And then we also know that 5% of adolescents will develop problematic pattern of substance use that meets the criteria for the substance use disorder. And there's also a gap in high quality, low barrier, low prevention education materials for youth. While I was doing some research, on average, substance use disorder prevention programs cost $121 to $300 per student, which many schools, many youth groups, many different resources that want to provide this prevention information to the youth don't have that financial ability to do this. And so therefore, we created the Protect Your Brain. Some of the things that we really hope to meet for the learning objectives is to contribute to the prevention of a substance use disorder. We really want to increase knowledge about risk and protective factors for the individual who's viewing this information. We also want to help provide them with tools and strategies to reduce the risk of developing an addiction and improve those risk factors. So we've created 3 videos, which really discuss different information that's really imperative for youth. So the first video, Protect Your Brain, discusses how during the ages of 10 to 19, the brain is changing rapidly. And because of this, it's extremely important to protect your brain. We know that you can pick up languages more easily, you can start new hobbies more easily than like someone like me as an adult can. And so that's your brain is very vulnerable and it has a power to pick up things more easily, but then it also has this challenge where it can be damaged more easily. Then the next video is Mind Your Genes. So this explains the genetics account for 50% of someone's likelihood of developing an addiction. And so this is so important to know about your genetic predisposition and your family makeup. And so it really describes how the risk is also influenced by individual choices. So just because someone has a genetic predisposition doesn't mean they're going to develop a substance use disorder, but they can learn how to mind their genes and avoid developing a substance use disorder. And then the other video really focuses on age, and it's called Age Matters. And it talks about how research shows that 90% of people with a substance use disorder began using drugs and alcohol before the age of 18. And so we built these videos and we created an e-course online, which I will put into the chat. And right now, what we're doing is we are pilot testing the course before we translate the videos into different languages because we want to make sure that these videos are hitting on the learning objectives. Once we get affirmation or we make some changes, then we will be translating these into different languages to be able to offer to the different communities. And then we also have been in the works on working on other languages. We've had some great volunteers who have translated some of these pieces into different languages. And so our hopes is over the next year, hopefully to be able to release Russian, Portuguese, Korean, and Hindi. Thanks to these wonderful people who are like, my community needs this, let me translate it, and let's get it out there so that we can help more communities. And so if you're ever interested in whether it's reviewing things that we create, maybe translating something into a language that's really abundant within your community and really could benefit from these resources, feel free to reach out to me. I really, we need your help. We are a small nonprofit, and as we all know, the climate of the world right now is very challenging. So if this is something that you can utilize, please let us know. And there is no cost. Any of the resources that I've talked about today are all free. They're all free, open source. Please utilize them. They're there for you to utilize and share broadly. I will share, though, that there is an opportunity to co-brand. We know that within this space, we are understaffed, don't have a lot of resources financially. And so there is an opportunity if you would like to co-brand, which is the only time you would ever have to pay some money. But we wanted to provide an opportunity for folks to take things that we've created that is research-backed, evidence-based, and then be able to disseminate it within your communities. Sometimes we know that trusted messengers, maybe you are the trusted messenger, maybe you are a faith leader, maybe you are the health department, maybe you are a doctor, and maybe you want to relay this information. If they see your logo or your seal of approval within something, they may be more willing to access and read the resources. So we wanted to provide an opportunity to that. So any of the resources I've talked about today, we're able to co-brand. You can either do a bulk co-branding, you can do single co-branding. And then the video explainers, we're also able to co-brand. And there's different options, whether you just want your logo on it. We can put an intro in it with a little like a little video from you or someone in your organization, or an outro. And so there's very different options. We just wanted to make it easier for folks to be able to disseminate this. You do not have to co-brand. You can use all of these resources, or you can co-brand them if that's something that you would like to access. And this is some examples of a couple of the co-branding things. And so I know I covered lots. I went really quick. I will put the YouTube channel in the chat, but I really appreciate everyone being here. This is such an important topic, and I'm really grateful for the partnership we've had with ECORN-MO, and be able to serve on their board, because the work that they're doing is so important. I also, real quick, want to give a shout out to the Department of Public Health, St. Louis County, especially Ezra King. Another initiative that we really work on with Stigma is our anti-stigma curriculum. Currently, it is only offered in English. Our hopes is one day to be able to translate it into different languages, but they are evidence-based training programs. One is 8 hours and one is 3 hours, and they are shown to increase addiction knowledge and decrease stigma among attendees. And the Department of Public Health, St. Louis County, attended our Anti-Stigma Institute that we had in April, and are certified to deliver the trainings. So if you're interested in attending an Encompass training, sending someone to Encompass training, or responding to addiction training, you can reach out to me, or you can reach out to the Department of Public Health, St. Louis County, and we can, or you can, or ECORN-MO. I'm sure Sal would be able to help, navigate the connections. But they're offering the trainings within the community, so it's great to know that they're offered. We also have 370 instructors across the United States and even in Puerto Rico. So if you're interested in receiving a training within your community, please let us know. We can connect you to someone. We also have an Anti-Stigma Institute in September on the 29th and 30th. Where you can become certified to deliver those trainings. You get access to community baseline stigma survey, as well as a social media campaign. So I, again, really appreciate this opportunity.